Alright, let's talk about mood stabilizers. If you've ever been diagnosed with bipolar disorder, it can be quite scary and confusing. What does that mean, and do I really need medication? The first thing I want to mention is that, like any mental health illness, these are subjective, meaning it's based on how we feel. There's no blood test, there's no image of the brain that can tell us if we're bipolar or not. So if you ever got this diagnosis, just know it's not 100%, and it's really more of a description of what's going on in our life than a definitive diagnosis. The hallmark symptoms of bipolar disorder is that we feel at different times either very depressed and low in our mood, or very elevated, amped up, sped up. We feel like our mind is racing, everything is going really quickly, we're speaking quickly, we have a million things we want to do, we're very goal-oriented, we might become very grandiose and feel like we're on top of the world, we can do anything. Our mood can be very exaggerated and everything is go, go, go. We don't need to sleep much, if at all. We can go days on end without sleep, and that's what we call a manic phase. If you've dealt with this before, you can probably attest that it leads to consequences in the end. Not only are we not in our best mind, but it can also lead to a depressive crash when we're done feeling manic. Some of us like the feeling of mania, especially at the lower levels, and these are things we can control through our daily habits, routines, proper sleep, exercise, nutrition, social rhythms, working through some of the stressors in our life. But when it comes to medication, there are some tried and true great options that we can talk about.